Terry and Mark Carson like to take an evening stroll with their two children, 5-year-old Kaylin and 2.5-year-old Kenzie. It's a time for the family to exercise and talk about what happened at preschool and at work. Once they arrive back home, it's time for a healthy snack. Terry understands that exercise and 3 a day of calcium-rich milk, low-fat cheese, and yogurt are the easiest and most wholesome ways for her family to meet their calcium needs and build strong bones.
My husband and I really reinforce the importance of milk all the time. They see us drink it, and so we give it to them to drink. We let them know it's going to make them big and strong.
Terry serves the kids milk in their favorite colorful plastic cups. Not only are they shatter resistant, but they make great toys. So snack time's not only healthy, but fun.
I'm drinking milk.
While the Carson family enjoys eating low-fat dairy foods, some families, especially African American, Hispanic, and Asian families, may avoid them for fear of lactose intolerance. Lactose is the name for the natural sugar in milk. Some people do not produce enough of the enzyme lactase needed to break down and digest this sugar. In some cases, these individuals may experience the symptoms of lactose intolerance, including abdominal cramps, bloating, gas, and diarrhea after eating or drinking foods that contain lactose.
For those people that have symptoms, it's important to know that symptoms occur depending on how much milk you drink at any given time.
There you go.
By following a few tips for tolerance, most people can still enjoy low-fat milk, cheese, and yogurt. These tips include: start with small portions and gradually work up. Drink milk with meals or a snack instead of on an empty stomach. Try aged cheeses like cheddar and Swiss. They're naturally low in lactose. Enjoy yogurt. Cultured dairy foods like yogurt contain friendly bacteria that help digest lactose. Try lactose-reduced or lactose-free milk. During recent decades, children's intake of soft drinks has risen dramatically, whereas their intake of milk has declined.
Most kids have replaced milk with sugared beverages. That is an alarming trend.
Unfortunately, soft drinks not only contribute to obesity, but studies have shown that intake of soft drinks at the expense of low-fat milk may compromise children's calcium intake and increase their risk of bone fractures during youth. Studies show that eating more low-fat dairy foods may actually help reduce the risk of some chronic diseases disproportionately affecting minority groups.
It's important to help reduce hypertension, and it's also has been shown to obviously help reduce the risk of developing osteoporosis later on in life, and also help to reduce the risk of certain cancers such as colon cancer.
Karen Kim stopped drinking milk voluntarily when she started college.
I thought I might be lactose intolerant, given the fact that many Asians are.
But when she and her husband wanted to start a family, she was concerned that she needed a healthier diet.
Small quantities with a meal. You should be able to drink milk and enjoy the health benefits of drinking dairy products.
My concern was that if I didn't drink milk, that I wouldn't have enough calcium supplements for, I guess, my own bones and for my children.
Karen now has low-fat milk and other low-fat dairy products in small portions. This way, she doesn't put herself at risk of an upset stomach. And she's teaching 11-year-old Caitlin that 3 servings of low-fat milk, cheese, or yogurt should always be part of her daily diet.
Up until now, she has been fine drinking milk. She drinks milk at least once, if not twice a day.
Caitlin says most of her classmates don't bother with the soda machine at lunchtime. This is welcome news to her mom, and a sign that the healthy nutrition choices at home are not forgotten at school.
I think they just know their parents probably have told them that milk is good for you and you should be drinking a lot of milk.
Good advice. Here's some more. Avoid self-diagnosis. Talk to your pediatrician and get tested to be certain. Then follow the tips for tolerance to enjoy low-fat dairy foods and reap the health benefits.